Ramaswamy Govindan, Professor of Medicine, Washington University School of Medicine in St. Louis. I think we have to clarify a few things. We do cure cancer even today. We've been curing lung cancer for quite some time, and that may come as a breaking news for some people, but the reality is this. If you have early stage lung cancer, let's say, for example, stage 1 lung cancer, tumors less than, let's say, 3 centimeters, we cure about 70 to 80% of those patients. And in fact, about 10 years ago, we published a paper looking at nearly 1,000 patients with stage 1 lung cancer treated at Washington University in St. Louis. We looked at the survival rate. It turned out that nearly 78% were cured. And more importantly, the cancers that came back often did so within a year and a half or so. So the two important things, if you have a very early stage cancer, stage 1 cancer with no involvement of any of the lymph nodes, undergone adequate operation, you actually end up curing a substantial number of those patients. What about patients with larger tumors or tumors that have metastasized to the regional lymph nodes or the lymph nodes within the chest? We call them stage 2 or stage 3. Stage 2 are those cancers typically when the cancer has gone from the lungs to the lymph nodes within the lung, what we call the hilum, or just outside of the lung. And when we take those groups of patients, we have been curing those patients with surgery alone in about 40 or 45% in the past. Now, with the addition of chemotherapy, we have ended up increasing the cure rate anywhere from 45 to now 55 or so. So we've increased the cure rate by about 10 to 15% in that population. So if you have a stage 2 lung cancer where you get lung cancer, when you have a cancer in the lung and metastasizes to the lymph nodes, and you had surgery, appropriate surgery with clean margins and adequate removal of those lymph nodes, and had received adjuvant chemotherapy, that is in the post-operative setting, you got appropriate chemotherapy, your cure rate can be as high as 50 to even 60% in some instances. And so that's with stage 1 and 2. What about stage 3 patients? That is, stage 3 patients typically are those with cancer in the lungs and involvement of the lymph nodes within the mediastinum or the space between the two lungs. And those patients are, in general, today treated with chemotherapy and radiation, followed by immune therapy. And surgery probably does not play a major role in this group, except in a small numbers of patients. Regardless, when we use what we call multimodality therapy with systemic therapy, that is drugs given intravenously, and radiation therapy to the chest, in the past, without immune therapy, we were curing approximately 25 to 30%. And that number has gone up by another 10 to 15%. And now we could cure about maybe 35 to 45% with chemoradiation followed by immunotherapy. These are still a little early days, but I think we can cure about, safely we can say that 40-45% of patients with stage 3 lung cancer with immune therapy preceded by chemotherapy and radiation. Of course, these are general numbers. We are very good how a group, as physicians, you're very good in saying our group of patients too. It's very hard to say how long a single individual would live or whether somebody will be cured or not from day one. But the important thing is the trajectory that we have seen over time. We have been curing more and more patients with stage 1, stage 2, and now we have made a big leap forward with stage 3 lung cancer. Also, I want to say that with the improvements in our diagnostic technology, with the use of PET scan to identify patients who have metastatic disease or early metastatic disease, picking up the right set of patients, and focusing our treatment on truly stage 3, stage 1, 2 patients with what we call definitive therapy, surgery in stage 1 and 2, chemotherapy and radiation in stage 3 patients. We have been able to identify the right set of patients for these intense therapies, and we've been able to increase the cure rate for stage 1 to 3 with a combination of appropriate diagnostic tests to identify the right patients and appropriate therapeutic strategies. And we are still, we are not there where we want to be, and we still lose significant numbers of patients with stage 2 to 3 patients despite doing all these things. And our research today is increasingly focusing on identifying those patients who are high risk for relapse, stage 2 and 3 patients, despite our current intensive therapies, and then coming up with more appropriate clinical trials to really keep increasing the cure rate. As far as stage 4 lung cancer is concerned, today it's hard to say to anybody that we're going to cure your stage 4 lung cancer patients, but I see increasingly patients with stage 4 now living past 3 years, 4 years, 5 years, and some of my patients with stage 4 lung cancer with biopsy-proven metastatic disease to the lung, to the brain, or the other areas of the body have been cured and now living 6-7 years with no active therapy, with no active disease. It's a very small number. So it's very important for us not to mislead our patients or the public by saying that we can cure patients with stage 4 lung cancer, but we're beginning to see patients who are now living longer and longer. When I began practice of lung cancer many years ago, almost 25 years ago, most of our patients with stage 4 lung cancer lived a few months to some months. We had barely 1 or 2 forms of therapy. That said, we didn't really have many options for these patients. We didn't do gene testing. Immunotherapy was non-existent. And in those days, 1-year survival rate for patients with stage 1 lung cancer was barely 30%. Only a third of our patients lived a year or longer. But today, that number, 3-year survival rate, is getting up to about 25 to 30% in some groups of patients, especially with the use of immune therapy. We are doing far better in EGFR mutant and ALK positive lung cancer patients. Even though we don't use cure, many of these patients are on chronic therapies. We're beginning to see long-term survivors. And I do think we will see progressive improvement in overall survival in these patients, and hopefully we'll end up curing some of our patients with stage 4 lung cancer. I want to quickly say a few words about a special group of patients with stage 4 lung cancer. Now and then we see patients who have cancer in the lung, metastasized to one spot, one area in the brain, or one lesion in the liver, one lesion in the adrenal gland, the gland above the kidneys. And we've been curing those patients by giving not only chemotherapy or immunotherapy and then resecting some of those lesions. And that's applicable to a very, very small group of patients, what we call oligometastatic disease, where patients that have 1 or 2 sites of metastatic disease. We've been curing some, not all, of these patients with aggressive approaches, including surgical resection. It's a bit controversial. We have to select the patients very carefully. It has to be truly a few sites of disease, and they have to be shown that these are not the first of many sites of metastatic disease over time. And we select those patients for radical surgical options. And in those patients, we probably can cure a little higher numbers than obviously patients with widespread metastatic disease. So my hope is in the coming years, we'll be curing more patients with stage 1 and 3 lung cancer. Already we are doing fairly well compared to what we were doing 15 years ago. Stage 4, we will begin to see in some select subgroups patients who are long-term survivors, and we may be bold enough to call them cured in the coming years. And I'm hopeful that that'll happen in the next several years.